Good morning, everyone. Susan Bohoric here, Centera Susan. Happy Monday. I hope you're having a great day. So last week we were supposed to have Wellness Wednesday. Unfortunately, my doctor scheduled to do Wellness Wednesday had patients. And you know, patient care is job one here at Centera Northern Virginia Medical Center. So we are doing Medical Monday with Dr. Arthur Vayer. Thank you for joining us, Dr. Vayer.
Oh, my pleasure. Happy to be here.
Yes, he got roped into this, but he's a good sport. So first off, for those who don't know, SMG surgery specialist, tell us, what does that entail?
Well, we're a group of general surgeons, and what we do is basically general surgery. So kind of a little bit of everything, skin lumps and bumps, all sorts of belly surgery, hernia surgery, and my subspecialty is colon and rectal surgery. So operate on a lot of colon and rectal cancers and proctology and inflammatory bowel disease.
Okay, and that's especially timely given that March is Colon Cancer Awareness Month. One thing I've noticed is that it's not so much Colon Cancer Awareness Month, but colorectal. What does that mean? Is it still the same thing? Is it just everything and more?
It is the same thing. It just includes the lower cancers of the GI tract called rectal cancer. So just so we get everyone and hopefully alert everyone to go get screened, because colorectal cancer is truly a preventable disease.
You know, unlike some of the other cancers, like if I had some sort of mark on my face, I could say, oh, there's something on my face, I need to go get that screened. You know, since it's inside, maybe you don't know. First off, who is at risk? Is everyone at risk? And when should you start your screening process, and what does that entail?
Okay, well, everyone's at risk. We're Americans. We eat an American diet. Not so good for us. And we can grow polyps, and those are precancerous lesions that don't typically give you any symptoms. Unfortunately, with colorectal cancer, by the time you have symptoms of either severe rectal bleeding, change in bowel habits, abdominal pain, those are potentially all signs of an advanced cancer. So you want to get screened. Current recommendations: every American starting at age 50 should get a colonoscopy or some sort of screening. African Americans, because they're at a little higher risk for colon and rectal cancer, should start at age 45.
Okay, that's a lot of good information there. Men more than women, or is it just really one of these non-discriminating kind of diseases?
No, non-discriminating at all. There are some groups that are a little higher risk and should start their screening early. Family history of colon and rectal cancer, or personal history of polyps, you need to start your screening earlier.
Okay, and I think a lot of people are kind of worried and think, oh my gosh, you know, to have a colonoscopy, there's a lot that goes into it. Tell us a little bit about that process. I mean, I'm sure as the years have gone on, you know, obviously advancements, and it's really kind of, I don't want to say painless, but they put you out, right?
Well, it is painless, yes.
Oh, okay,
yes,
great.
Because we do heavy sedation, so people are completely out. They don't know anything going on. Once they get through the prep, which is a little bit arduous, but they do have to clean themselves out so we can see well, and there are some good preps that are minimally miserable, if you will. But once the prep is done, we get them sedated. The procedure takes about 15 minutes. And usually quite easy to do.
Wonderful. And yearly or every 5 years? Or
no, if you don't have any polyps, you get done every 10 years.
Woo.
Okay. If you do have polyps, depending on the aggressiveness of the polyp, we look again in either 1, 3, or 5 years.
Okay. We're having a little bit of a scanning overhead, so hang tight. We've got a overhead announcement. I don't want to battle it. I don't want to compete with it. Okay. So 10 years if you have a clean bill of health, no polyps. Okay. I'm 50 years old. What should I do? How should I get the ball rolling?
Well, first, easiest to see your primary care physician. They can give you a referral if necessary to go see either surgeons like in our practice or a gastroenterologist. Those are the two specialties that typically do that procedure. Have the test done. If you have any polyps, get them taken out, because the polyps that are removed will never cause trouble. So hence, colon cancer is a preventable disease.
Wow. What do you want people to know? What do you want the nugget that people take with them today? What do you hope it is that maybe the one thing that they, you know, take into their day?
Get the colonoscopy, get the polyps out, never get colon cancer.
Dr. Vayer, great information there. Thank you so much for
My
your time
pleasure.
today here on Medical Monday. Okay, so you've gotten this great information. You're scratching your head saying, hey, I need a doctor. You know where you go? You go 1-800-CENTERA and you find a provider near you. 1-800-CENTERA, toll-free call, and as easy as dialing your phone. Thank you all so much for joining us here on Medical Monday. We're going to try to turn it back onto Wednesday, but you know, we're just flexible here because we're in healthcare. All right, everybody, have a great day. Talk to you soon. Be careful out there.